Hello. As a nurse psychotherapist in a large northeastern city, which has lost over 23,000 people to COVID-19, both fear for myself, for my patients, my loved ones, and grief have affected my mental health on many days over the last 6 months. These are the same emotions that my patients are experiencing, along with anxiety and depression, and uncertainty about the future, how long the pandemic will last, and how our lives will be changed. Balancing fear with scientific knowledge has helped me and those in my care, some of whom are particularly vulnerable to the effects and severity of COVID-19. Like my fellow nurses, I've struggled with grief and sadness about the loss of life all around us, the loss of freedom and lifestyle, and the loss of vitality and a strong economy in our city and our country. Perhaps the most distressing emotion is the sense of helplessness that many of us, both care providers and care recipients over the age of 65, have experienced when we haven't been able to be on the front lines. It results in a kind of moral distress, not being able to do what you know would be effective. As therapists, add to that the lack of adequate and accurate scientific knowledge about the virus. It means we have difficulty answering questions, being able to reassure, being able to help people with prevention, and giving them some reassurance about the time it will be before we can all be together again physically, and I can comfort them physically. I advise my patients to cope by making coping lists, active lists, and I do that myself. Long and very energetic walks take me out into nature. I can stay pretty much away from other people, and I get to be with all the things that refresh my energy, the birds, the flowers, the trees, other people, the sunlight. Communicating with friends and family every day by phone, email, or some other mode. It's essential. And planning at least once a week to get together with friends at a distance, somewhere on the outside, like a picnic, or some COVID-compliant restaurant, really boosts the spirits. We get to see people in 3-dimension. It's a great boost. Making and listening to music are high on my list of spiritual care. Guiding others and caring for their own spirits is really at the heart of our work. We could be doing a lot more to advance the mental health of nurses. An important first step would be to abandon the idea that health professionals, but especially nurses, must be stoic and impervious to mental health challenges and problems with substance use, from cigarettes to opioids. When we hold on to that belief that we aren't afflicted with it, we don't come down with depression or get into difficulty with some drug, it's not the reality. It results in shaming and stigmatizing nurses who do develop problems. Currently, nurses have higher rates of suicide than the general public. They use excess alcohol at about the same rates, and they tend to overutilize prescription drugs more than the general public. We need to act to end stigma so our colleagues who are struggling with mental health problems and those who are in recovery will believe that they can ask for help and receive it without being judged by their colleagues or supervisors. We need to invest in mental health for the obvious humanitarian reasons, but we also need to invest in mental health because it saves lives and increases productivity in our societies. If hospitals, universities, and clinics offer employees access to mental health care, research tells us that we decrease the number of employees' sick days and we increase job retention. When health insurance covers psychological as well as medical care for mental and psychosocial disorders and substance use disorders, nurses will be able to access care earlier and get well sooner. This pandemic provides a prime example in which nurses and other healthcare professionals will be able to return to work and their personal lives with greater health when their insurance lets them access psychotherapy, evidence-based treatment for substance use disorders, and a range of alternative modalities to build their strength and restore their health. Employers can also invest by improving workplace safety, by educating about and taking steps to decrease workplace violence, bullying, exposure to trauma, and evaluating employer demands that restrict rest and personal care time. We can preserve our nursing workforce. We can improve society's health and decrease disability if we partner with employers to address these issues. Thanks so much for listening to my story, and stay well.